Hi everyone, it's Dr. Mark, and today I'm going to talk to you about your blood work. And what we're going to do is we're going to do this in segments. So today we're going to be talking about the white blood cells, and there's 5 categories of them. You have your lymphocytes, your neutrophils, your eosinophils, your monocytes, and your basophils. Now, we've talked about half-lives before, and really what half-life means is how long something stays in you or how quickly it disappears. And for the most part, the lymphocytes have the longest half-life. They're going to stay in your system for up to 3 weeks, whereas the rest of them are typically hours or maybe a day or two. Now, they all have different specific categories, and as a rule with white blood cells, if they're elevated, that means you're probably having acute infection of some sort, and if they're decreased, that means you have some sort of a chronic issue going on. And again, for example, eosinophils are more related to, if they're elevated, probably allergies, asthma. The rest of them all kind of deal with, if they're elevated, it's probably some sort of a bacterial infection. And if they're usually suppressed, it can be due to chronic autoimmune disease or taking steroids. So now what we're going to do is I'm going to send you a link that'll be attached to this presentation, and you can look at your blood work and find out, are you in the healthy range or the clinical range. And you got to realize that clinical range is broader because it has everybody included, unfortunately, people that do have cancer. Now, I'm just going to give you one little clinical point here, a little clinical gem, is if you ever see your eosinophil and your monocytes both elevated, that means you have some sort of a parasite going on. And when I say parasite, I'm not talking about some big tapeworm that's coming out of your backside. A parasite, by definition, means anything that lives at the expense of its host. And if those are both elevated, then there's a very simple supplement you can take to get rid of that parasite. And once again, you can then retest yourself in a month to see, is the therapy that you're doing is effective. So I hope you learned something today, and please private message me if you have any questions. Have a great day.